Let's talk about giant cell arteritis. So giant cell arteritis is also called temporal arteritis. Why? Because your temporal artery is inflamed. Itis is inflammation. So your temporal artery is inflamed. So this is usually seen in an elderly female, like you can see here in the image. And when when the patient's temporal artery is affected, all the areas that it supplies blood to is affected. So as you can see in this image, there will be some scalp tenderness. Whenever she's combing her hair, her scalp will start paining. She'll have headache, and this eventually leads to ophthalmic artery inflammation as well. So when the patient's ophthalmic artery is inflamed, she will have transient visual field loss. Alright, that is temporary visual field loss. And her jaw is also affected, so there will be jaw claudication. So the symptoms are very clear: headache, all the places where the temporal artery is affecting. Just remember this image here. Headache, scalp tenderness, transient visual loss, which is a very important feature. Age is usually greater than 50 because this is an elderly female. Jaw claudication, and it is usually associated with polymyalgia rheumatica. So we will discuss about this later on. But polymyalgia means poly is multiple muscles. Myalgia means muscle pain. Algia means pain. Poly is polymyalgia. So multiple muscles are painful. All right. And when you do the investigation, the first thing that you have to do is ESR. So ESR will be elevated, will be very much elevated, usually greater than 30. Alright, so the first thing that you do is ESR, and then you do a temporal artery biopsy. Alright, this is the most confirmatory test, and you'll see when you do the biopsy, take a little bit of the temporal artery and do a biopsy, you'll see that there is vasculitis going on. Alright, so whenever the patient comes with these symptoms, especially if it is an elderly female coming in with these symptoms, and especially whether she has visual field loss or not, whether this symptom is present or not, just give the patient high dose prednisolone as soon as you see that her ESR is elevated. You do nothing, just give her high dose prednisolone. And you do not wait for biopsy, or you do not waste time doing any further investigations. Just give a prednisolone so that the ophthalmic artery that is inflamed in this patient won't cause permanent blindness. Alright, just save her eye, give her some prednisolone, and you'll also add on some aspirin along with prednisolone later on. But the first thing that you need to do is prednisolone. Nothing else, just prednisolone for giant cell arteritis. Alright.